question here. A client is brought to the emergency department and having experienced the blood loss related to an arterial laceration. So which blood component should the nurse expect the healthcare provider to prescribe? So this is a wonderful question where we're going to learn how to answer. I'm going to explain this question in a different way, right? So the client is brought emergency department having experienced the blood loss related to an arterial laceration. My friend, blood loss, which one I give? Platelets, granulocyte, frozen plasma, or packed red blood cell, right? Example, I want to tell you, red blood cell, we give them if my patient have erythrocyte or red blood deficiency, right? Red blood deficiency. Or if my patient has blood loss, I give them red blood cell. So why not I choose number 4? Reason being, this keyword, blood loss related to atrial laceration. So if the atrial laceration is not there, I can choose the red blood cell for this answer. Because of this keyword with the blood loss, I'm not choosing this one because I have a better option. I have a better option, I said. So next here, granulocyte. I'm not choosing the granulocyte because granulocyte I give if my patient have any very bad infection and which is like a septicemia, not enough to control even by antibiotics. So this question is not related to septicemia or any infection. So I am not going to choose number 2 as well. Platelet, I choose if patient have any kind of thrombocytopenia, means total count of WBC is less, or patient has any kind of bleeding tendency, bleeding disorder, but this question not related anything bleeding tendency or blood disorder. They're talking blood loss, what is related to atrial laceration. So I need to give something, increase the total volume of blood. Because when blood loss, blood volume drop. When blood volume drop, blood pressure drop. When blood pressure drop, it leads to shock, and shock lead to death. So I have to choose something help to increase the blood volumes, right? So in that case, frozen plasma is a good choice that increase the volume. You see the plasma, and plasma always keep in frozen. So we choose this one. So now let me go back in the explanation what they said. Frozen plasma here. Let me see. A fresh frozen plasma is often used for volume expansion as a result of fluid and blood loss. It is rich in clotting factors. So plasma also contain so many factors. This factor help to clot the blood as well, right? So next here, platelet are used to treat thrombocytopenia or platelet dysfunction, like bleeding tendencies. And also, they said granulocyte may be used to treat client with a sepsis or neutropenic client. Neutropenic means neutrophil is go down, or patient with infection. And packed red blood cell are the blood product used to replace erythrocyte. If patient have any erythrocyte defect or drop, we can give it to them. So next, in this question, we can see a nurse who is about to begin a blood transfusion and knows that blood cells start to deteriorate after a certain period of time. So every blood cell has a particular timeline they could survive, and after that they will die. This is the information in this question. What next? Next here, the nurse take which action in order to prevent a complication of blood transfusion as it related to deteriorate in blood cell. There are 5 options, my friend. If you do not know how to read the examiner mind, you will do wrong to answer this question. Most of all, know that before blood transfusion, we have to check something. Like we have to check the blood type, we have to check the, any kind of infectious disease or not. We have to know the cross matching. We have to check the vital sign, right? But question not about anything like this. And this question particularly mentioning here, you have to focus the blood cell start to deteriorate after certain period of time. So you have to choose anything related to this information. You don't choose anything is related to the absolutely blood administration or blood transfusion. Okay. So they said select all that apply is related to deteriorate of blood cell. Like number 1 said, check the expiration date. Definitely it is. When you get the blood bag from blood bank, we are 2 RN have to check it. First I will check, then another RN do the cross checking for confirmation. Date is important. If anything expired, we never ever put it to the patient. Then inspect for presence of clot. Presence of clot where? Where? Inside the bag or patient body. Nothing clear about this question. And also, it is not related to the deteriorate after the certain period. I mean, the cell lifespan, not related this. Check the blood group and type. We must do this. Check the blood type, blood group, and also cross-matching. Sometimes NCLEX asks, in order to determine the donor compatibility, what must be done? Means we check the blood type and cross match. But this number 3, important but not related to this question answer. This question, because it is nothing related to deteriorate the blood cell or lifetime. Check the blood identification number. It is super important. Must do this, must check it. But again, I said this also not directly related to the blood cell lifespan. Because in this question, the last section mentioning clearly the nurse take what action in order to prevent the complication of the blood transfusion is it related to deteriorate the blood cell. But I say number 2, number 3, and number 4 is important but not related to the deteriorate of red blood cell. Number 4, 5 hangs the blood within a specific time of frame per agency policy. Yes. So if time is expired or if you give a longer time, definitely it is not healthy for the patient, because this is a blood cell be survive outside the body for a particular time. So if you do something according to your choice, it does not allow. So we have to follow the national guideline. We have to follow the agency policies. This is also the good choice. Let me read their explain what they said. So nurse note the expiration date, and also blood cell begin to deteriorate over the time. So safe storage usually is limited to 35 days. Careful notation of the expiration date by the nurse is essential part of the verification process before hanging as a unit of blood. The nurse also needs to hang the blood within the specific time frame after receiving it from blood bank per agency policy to ensure that the blood being transfused is fresh. Last line, the blood bank keeps the blood regulate at a specific temperature for a long time, but it is does not possible to keep in the outside or in the hospital floor, right? So go the next. Here, a client requiring surgical operation and is very anxiety work, right? Is anxious about the possible need for blood transfusion during or after the procedure. So, you know, if we go for any kind of surgical operation, you doctor can tell you need any blood or not. Usually minor surgical operation do not need any blood transfusion. But in some operation, really a huge blood loss, so hospital should be prepared for the blood transfusion if need. Like your patient in this question, they are very stressed tension, anxiety because of blood transfusion, because they need blood transfusion. The nurse suggests to the client to take which action to reduce the risks of possible transfusion complication. So if I need blood transfusion, 1,000 question in my mind. What question come? Will I start any blood transfusion reaction? Or question come, the person who donate the blood, is it good or bad? Any infectious disease there or not? Although the hospital authority must check it, there are any kind of infection through the blood transfusion or not, they should check it before, but still question come in my mind because I'm the patient here. So in that cases, if any clinical scenario like this, your patient is too much tensed, then what you have to tell them? So select all that apply. Let me recap the last part of this question. The nurse suggests to the client to take which action to reduce the risks of possible transfusion complication. Out of 5, which is the help your patient to reduce the complication, even anxiety? Option 1, ask the family member to donate the blood ahead of time. So if you get the blood donor at home, it is good. Better to go outside of unknown someone, because in the same family, same genetic um, trait, right? Same gene, at least it is similar to your body. So if the donor and recipient best matching, the less chance to complication. Definitely it is a good choice. Ask your family, is there anybody can donate the blood? So you can receive it. Give the autologous blood donation before surgery. So here it is important to know the keyword autologous. So autologous means like I have a surgical operation next month or after 1 week or after 2 weeks. I will be the donor of myself. So the hospital can withdraw the blood, then keep in a bag, and this bag put in a blood bank, and during the surgical operation, same blood give to me. So in that scenario, the less chance to develop the blood transfusion reaction or adverse effect, less chance. So it is another best option. Number 2 is the best. If number 2 is not possible, number 1, another best option. Both can reduce the risks of complication. What about next? Take the iron supplement before surgery to boost the hemoglobin level. But it is good option, but it does not reduce the risks of possible transfusion complication or transfusion adverse reaction. Number 4, request that may donate blood be scanned twice by the blood bank. It is the protocol. If we have to check it, it is the accountabilities or hospital responsible it is. So always we has to scan it for any kind of infection is there or not. Also, we have to check the blood type. Also, we determined the donor compatibilities by type and cross matching. It is the protocol, but it does not reduce the risk of transfusion complication. Number 5, take adequate amount of vitamin C several days prior to surgical date. So again, I say it is not related to the surgery or blood transfusion. Vitamin C is good to healing up any kind of wound, but not related this one. So the best option we choose family member or autologous. What is their explanation? They said donation of the client own blood before schedule procedure is called autologous. Donating autologous blood to be reinfused as needed during or after surgical operation that reduce the risks of disease transmission or potential transfusion complication. The next most effective way is to ask the family member to donate the blood before surgical operation. Blood banks do not provide any extra scanning on request because they follow their protocols. Also, pre-operative iron supplement are helpful for iron deficiency anemia, but not helpful in replacing blood lost during the surgical operation. Vitamin C in enhancing iron absorption, but also is not helpful in replacing blood loss during surgical operation. What next? A client with severe blood loss and resulting from multiple trauma requiring rapid transfusion of several units of blood. So you see, this is a very serious condition. Patient has a multiple trauma. They need rapid blood transfusion, also several units. One is the rapid and several units of blood. The nurse asks another health team member to obtain which device for use during the transfusion procedure to help reduce the risk of cardiac arrhythmia. So when we get the blood from blood bank, it will be under the temperature, it would be cold, but cold blood you do not give to the patient directly, but your patient need rapid blood to save the life, and they need several units of blood to save the life. And I said blood will be cold when bring from blood bank. So we have to have something to make it normal room temperature, then infuse to the patient. So first of all, what? Infusion pump. Infusion pump is important. We must need, but what is most appropriate for this question? How you have to prevent the dysarrhythmia? Infusion pump does not prevent the dysarrhythmia. Pulse oximetry is a device. You check the saturation of oxygen, right? like 96% of oxygen is good for the patient, but nothing related to stop the cardiac dysrhythmia. Cardiac monitoring. Cardiac monitoring can tell you what are the cardiac events of the patient. Nothing can prevent or reduce the risks of cardiac arrhythmia. Question come, why your patient turns to develop cardiac arrhythmia? Because if you infuse rapid transfusion, several blood in a cold temperature, but I said we need to make it room temperature. So we need something blood warmer device. Definitely we do not need to the microwave to put it that temperature change. We need blood warmer device. What is their explanation? They said in several units of blood are to be administered rapidly and blood warmer should be used. Rapid transfusion of cold blood has a chance to develop the cardiac arrhythmia. To prevent this, the nurse warm the blood with a blood warming device. Basically, this we learn from this question. What next? A client has a prescription to receive a unit of pegged red blood cell. The nurse should obtain which IV solution from the IV storage area to hang with the blood product at the client bedside. My friend, if you go in the hospital, you can see the stand we use for the blood transfusion. It is called T stand. It is look like the letter T. The T stand has a two hand. One side we give the blood transfusion, another side we hanging saline solution. Question is here, what saline we put here? Basically, it is the note you have to write down. During the blood transfusion, we always keep the normal saline solution. And normal saline solution is a 0.9% sodium chloride, right? So definitely this is the answer here, what we learn. And 0.9% sodium chloride is an isotonic solution. So that tonicity or concentration of solute dissolve the particles in equivalent to extracellular fluid. So first of all, there are three types of solution. In other class, I will explain. One is called hypotonic. Another is called hypertonic, like 5% dextrose in 0.45% sodium chloride, or 0.5% dextrose in 0.9% sodium chloride. Both are hypertonic, means their tonicity is greater than extracellular fluid, right? So, like lactate ringer solution, a common question NCLEX would ask, if a patient came to the hospital with burn, what solution we give? We give them lactate ringer solution. This is the answer for burn patient. But here we are talking of the normal saline solution, right? So when you give the blood transfusion, always keep the normal saline beside the blood transfusion. If blood finish or if any kind of blood transfusion reaction, you immediately stop the blood transfusion. And at the same time, we start the normal saline solution. If you ask me what are the other use of normal saline or isotonic solution, answer is dehydration or shock. In shock, blood pressure go down and we give them isotonic solution. Fluid or volume deficit, we give them isotonic solution. And accompany with blood administration, always isotonic or normal saline solution. Let me read their explanation. Sodium chloride 0.9% is called normal saline, is a standard isotonic solution used to precede and follow infusion of blood product. Dextrose is not used because it causes the result of clumping or subsequent hemolysis of red blood cell. So dextrose, they are not an isotonic. Lactate ringer is not the solution of the choice for blood transfusion, but lactate ringer is the solution choice for burn patient. Very important for NCLEX board exam. Question here, the nurse is caring for a client who is receiving a blood transfusion and also complaining of cough. The nurse checking the client vital sign, which include temperatures 97.2 or 36.2 Celsius, the pulse 108 beat per minute. It is more than normal, right? And blood pressure 152 over 78, so a little bit higher. And respiratory rate is 24 beat per minute. And also oxygen saturation level 95% on room air is almost normal, 96 to 100, 95. The client deny the pain at this time. Based on this information, what initial action should the nurse take? But I said blood transfusion patient, when you check the vital sign, temperature is okay, but we know the blood transfusion reaction, temperature go up, but it is okay here. The pulse is little bit up, it is the sign of transfusion reaction. Blood pressure is systole and diastole blood pressure. Systole is little bit up than the diastole, is 76. Respiratory rate is 24 beat per minute, little bit up. Oxygen saturation is almost normal. The client deny the pain, so no chest pain, right? No chest pain. So then this is what initial action should the nurse take, right? What take? Collect the urine sample for analysis. it is not related to the urine sample in this question. So when your patient took the blood transfusion, always we have to keep it in mind. What are the potential blood transfusion reaction? If anything here, definitely we stop it. But in this question, we do not see any restlessness, any nausea, hives, shortness of breath, or fever. No chill, no back pain. But the vital sign is little bit fluctuate, higher than normal. So in that case, what we have to observe the patient. We have to compare, contrast the vital sign what we took before, what is vital sign right now, and observe for next 5-10 minutes. Then compare, contrast what is fluctuate. It is too much or okay. If it is fluctuates too much, definitely patient is not stable. So number one does not make any sense. Number two, place the client in an upright position. Patient does not tell any shortness of breath. So I do not need to immediately change the posture. Compare the current data to the baseline data. It is definitely because I have to observe, compare and contrast that data I took before. What are the data right now and even after 10 minutes? So if you see the data, vital sign is fluctuate, patient is not stable. Number four, slow the rate of blood transfusion. Also, you can do this, but vital sign compare is most important first. So let me read their explanation. For the client receiving a blood transfusion, the nurse should monitor for potential complication of a transfusion. One of complication is circulatory overload. Sign and symptom of circulatory overload include cough, shortness of breath, chest pain, wheezing, right? Also maybe headache. So I said fluid overload. Patient must present with shortness of breath, any added sound in the lungs, what we found in auscultation, or patient develop edema. So headache, hypertension, tachycardia, or bounding pulse, and distended neck pain, all with the complication of fluid overload. Based on the data to the question, the nurse should compare the current data to the baseline data. The nurse should also further assess the client for other sign and symptom of the circulatory overload. What next question? The question here, 1 unit of pegged blood cell has been prescribed for a client with a severe anemia. The client has received multiple transfusion in the past, and it is documented that the client has experienced, you see, it is documented. So in the past, when patient took the blood, they do not have developed any blood transfusion reaction, but only urticaria type reaction occur because of blood transfusion. Urticaria type infection means is the type of allergic reaction because of transfusion, right? So the nurse anticipate that which medication will be prescribed before transfusion of the red blood cell to prevent type of reaction. So urticaria, I said, it is the allergic reaction, like patient complain of itching all over the body or pruritus. So you need to give them something antihistamine. Out of four, which one is the antihistamine? Ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory medication. Acetaminophen, it is the non-steroidal for fever or mild pain. Acetylsalicylic acid is the aspirin. Diphenhydramine is an antihistamine for rash, itching, or pruritus. Definitely, number 3 is your choice. Their explanation. The urticaria type reaction is characterized by a rash accompanied by pruritus. This type of transfusion reaction is prevented by antihistamines such as diphenhydramine. That's it from here. In this question, we can say a client has experienced high blood pressure and crackles in the lungs during the previous blood transfusion. So I said, when we take the history from the patient, do you have any blood transfusion reaction before? But if patient do not know what are the blood transfusion reaction actually, you just ask them, after blood transfusion, did you feel restlessness, nausea, hives, shortness of breath, fever, chill, or back pain? During this conversation, the patient said high blood pressure and crackles in the lungs. So this is the crackles, actually the sign of overload. When you give the blood, a fluid you giving to me, I have chance to develop fluid overload. So crackles or added lung sound is the indicator of fluid overload. It is preventable. So the client asks the nurse whether it is safe to receive another transfusion. It is the question asked. But in this question, we did not finish yet. What is the last part? The nurse explained that which medication most likely will be prescribed before transfusion reaction. Before to go this judgment, my patient have to go for transfusion or not, it is not a question examine asks you. They ask you what medication can stop the crackles or what medication we give to reduce the overload of the fluid from the lungs. This is the question. So how we can prevent the fluid overload because of blood transfusion, right? So which drugs? Furosemide, acetaminophen, diphenhydramine, or acetylsalicylic acid. Number 2 and number 4 is not an answer because this is the NSAID, non-steroidal anti-inflammatory medication, nothing related to this question. These two we use for pain or fever. Diphenhydramine we use for rash or allergic reaction, urticaria, is the antihistamine. Diuretics, furosemide, we use for blood pressure, high blood pressure, or we use for fluid overload. They can expel out extra fluid from the blood body. So definitely the best choice, the smart choice is furosemide for this question. What is their explanation? Fluid overload is one of potential complication of a fluid transfusion and is characterized by variety of signs, including high blood pressure, fluid in the lungs that manifest as a added sound like crackles, distended jugular vein, also the sign of fluid overload. This type of transfusion reaction is prevented by giving diuretics like furosemide. The question, the nurse is told by a healthcare provider that a client is hypovolemic shock. Hypovolemic shock means blood volume go down, blood pressure go down, and patient develop shock and require the plasma expansion. The nurse should prepare which supply for transfusion. We are going to learn here what are the materials we supposed to use for plasma expansion, right? Which supply? A bag of platelet. Platelet is not used for plasma expansion. A bottle of albumin with vented tubing. Albumin is used as a plasma expansion. This is the note we learn from here. And it must be vented tubing, right? Infusion pump and bag of packed cell. No. For plasma expansion, we always use a bottle of albumin with a vented tubing. This is our answer. What is the explanation? Albumin may be used as a plasma expander. Albumin is supplied in a bottle. And platelet are used when the client platelet count is low. If patient has a bleeding problem like hemophilia or DIC, disseminated intravascular coagulopathy, or clotting defect, we can use the cryoprecipitant. That's it. What next? Next question is here. A nurse has disconnected one unit of blood that was infusion into the client because the client experiencing a transfusion reaction, right? It is very clear. After transfusion, blood patient develop the transfusion reaction. So after documenting the incidents appropriately, the nurse sent the blood bag and tubing to which department? Very easy, right? Which, where, send, and why? We send it blood bank for culture to identify if any kind of infection microorganism there or not. That's it. What is the rationale? The nurse returned the blood transfusion bag containing any remaining blood to the blood bank. This allows the blood bank to complete any follow-up testing procedure needed when a transfusion reaction has been documented. That's it. In this question, we can get the nurse has just obtained 1 unit of blood from blood bank for transfusion to the client. Before preparing the blood for transfusion, the nurse looks for which member of the healthcare team to assist the checking. I strongly believe every student know the answer. At least 2 RN. So I am checking another RN can help me, right? So answer is phlebotomist, medical student, RN, right? Registered nurses have to check it. So their explanation, depending on agency policy, the 2 RN or 1 RN and 1 licensed practical nurses must check the level of blood product together, again the client identification number, blood group, and complete the name. This minimizes the risk of error in checking the information on the blood bank and therefore minimize the risk of harm or injury to the client. A blood bank technician verify data which the nurse with the nurse when the blood is obtained from the blood bank, but not in the nursing unit. In the nursing unit, either 2 RN or 1 RN with other licensed practical nurses. So here question, the nurse is picking up a unit of pegged red blood cell at the hospital blood bank. After putting the pen down, the nurse glanced at the clock, which read 1300. The nurse calculated that the transfusion must be started by what time? So we have to start the blood as soon as possible. When blood is ready from blood bank, you check it, another RN can check it, temperature must be checked, not too cold, at a room temperature, and then as early. So out of these 4 times, as early times is here, it's just after 13 minutes. So their explanation, the blood must be hang as soon as possible within 30 minutes. So definitely this one within half an hour. After it is obtained from the blood bank, after that time, the blood temperature will be higher than 10 degrees Celsius or 100 degrees Fahrenheit, and the blood could be unsafe for the use. Right? We learn this. We have to put as early, and after 30 minutes, it is not safe for your patient.